A crisis within a crisis. 2020 is set to be one of the deadliest years of the opioid crisis, with overdoses reaching an all-time high across the nation. LEX 18 Sophia Millar looks back at the impact COVID-19 had on this vulnerable community and how recovery organizations stepped up to meet a rapidly growing need.
Federal and local governments are investing millions of dollars into solving the opioid crisis. And for a while, it was working. But then COVID-19 happened.
It's been scary.
Tadra Curry is in recovery after a decade of addiction to prescription opioids.
I just celebrated 4 years on January the 12th.
She relies on routine, work, family, and friends to keep her on track, just like a lot of people in recovery. So when Kentucky went into lockdown in March in the governor's effort to contain the spread of COVID-19, there were consequences. The shutdown disrupted access to substance abuse treatment resources like Narcotics Anonymous meetings.
I had 4 friends overdose in 1 week. Like every day of the week, somebody was dying.
Curry says the people around her started relapsing. David Zubak says he saw it too.
When you're closed in a house, it's almost like a jail cell. So I'm sitting there with all this idle time in mind, and I just don't know what to do, and that's what we tend to lead to.
Curry and Zubak work in substance abuse treatment centers and regularly attend Celebrate Recovery meetings. They're watching the role the pandemic is playing in drug overdoses develop in real time. But the depth of the problem wouldn't sink in until months later. In December, the CDC issued a health advisory after new data leading up to May 2020 revealed drug overdose deaths increased by 21% in the United States. In Kentucky, the overdose death rate increased above the national average to 27%.
The numbers are scary, but there's so many people in recovery too.
Curry says harm reduction organizations stepped up in 2020. When they couldn't hold face-to-face meetings, they offered virtual ones.
It's helped, but it's a lot different. You're looking at a screen, you feel like you're talking to yourself, and when you share in a meeting, people laugh and you don't get that.
The expansion of telehealth also made treatment options more accessible. But in the early months of the pandemic, many centers temporarily closed or stopped accepting new patients. And in this community, timing can make the difference between life or death.
We need to get them in bed today because they may change their mind in 3 hours.
Curry's employer is among those responding to the growing need. Addiction Recovery Care opened multiple new addiction treatment centers in 2020. Crown Recovery Center opened mere months after the coronavirus arrived in Kentucky. Now it's on its way to becoming one of the largest and most comprehensive treatment centers in the United States. ARC repurposed the former St. Catherine College campus into a 756-bed addiction treatment center. The center's CEO, John Wilson, says he doesn't regret opening in the middle of the pandemic.
The need for drug addiction treatment exists more now than ever because of COVID. The longer that we wait, the more people die. That's just the reality.
Wilson says they've adjusted to meet safety measures while trying to retain as much of the pre-pandemic normalcy as possible.
These are not bad people. They're sick people, and they just need help.
Patients living on the campus have access to healthcare, job training, and peer support. And while many of the meetings are in person, some have staff join via Zoom.
They never did this until COVID.
And so harm reduction experts are finding ways to adapt to the limitations of the pandemic inside and outside of residential treatment centers.
We're really addressing a pandemic within a pandemic. And this is the pandemic nobody wants to talk about.
And experts do say while overdose rates have not reached pre-pandemic levels yet, they are starting to decline. And so their work continues into 2021. Sophia Millar, LEX 18 News.